हेलो इवन। सो आज अवेयरनेस पे बात कर लेते हैं that the number of COPD and lung diseases in smokers is decreasing. Recent studies are showing this. Let us discuss why. तो जितने भी लोग frequently cigarette breaks लेते रहते हैं वो काफी खुश हो गए होंगे ये सुन के। तो it generally takes 30 to 40 years in smokers to develop COPD, and it generally takes 10 to cigarettes per day. So in term of packs years, it generally takes 30 to 40 pack years. So the question is ki, are smokers living that long? Why? Because there is a new epidemic coming, and that epidemic is young MI. So young Indians are very vulnerable to MI nowadays. In cardio emergency हम लोग डेली 4 to 5 यंग एमआई के पेशेंट देखते हैं जो 20 to 30s में होते हैं. नो कोमोर्बिडिटीज. ओनली द थिंग इज दैट दे आर स्मोकर्स. ओके. एंड देर इज एक्सटेंसिव STEMI in these patients. So इट डजेंट नीड कि आपको लॉन्ग टाइम तक स्मोक करना है टू गेट अ एम आई. ओनली अ सिंगल सिगरेट कैन कॉज एम आई. तो ऐसा नहीं है कि कोई 5 years 4 years 10 years से पी रहा है उसको एम आई हो सकता है. इवन इफ यू हैव योर फर्स्ट सिगरेट टुडे यू कैन हैव अ एम आई टुडे. वाई? बिकॉज द etiology is there is a study showing that smoking can trigger myocardial infarction in patients with minimal atherosclerosis or even with normal coronaries. So एकदम classic normal coronaries होंगी, especially among the young, prompting temporary coronary vessel occlusion as a result of thrombus formation or spasm. So basically smoking की वजह से क्या हो रहा है, जब the nicotine in smoking is causing the damage to the vessel acutely, leading to the thrombus formation there and complete occlusion of the vessel, leading to ST elevated MI. So another thing is the incidence of STEMI is more in smokers than NSTEMI. So there is thrombus formation there, बिल्कुल normal coronaries होंगी as compared to diabetics, क्योंकि diabetics में क्या हो रहा है, it's a long standing process. तो diabetes में because of hyperglycemia आपकी vessel damage हो रही है. The general takes long time and the vessels are atherosclerosis. But the etiology in smokers is not atherosclerosis, it is a thrombus formation. So a single smoke can lead to damage there, can start the coagulation cascade there and can lead to the thrombus formation in MI. So the numbers are drastically increasing. Every day in emergency we are seeing young MI patients. And it doesn't look like कि वो बहुत long time से smoke कर रहे थे. They generally says कि हाँ अभी 1 month से start किया and they'll end up in MI. So it is something that is increasing drastically. Might be because of the diet we are taking, and superimposed on that there is smoking, which is leading to the damage there. So LDL in blood and smoking both are leading to the damage there. So everyone knows this actor. So he died with heart attack at a very young age. These are multiple news. Even in my career, I have seen like thousands of young MI patients till now. And बहुत सारे ऐसे यूजी स्टूडेंट्स को भी मैंने देखा है who just died, and the cause people are saying is cardiac arrest or something, but the cause, major cause is smoking, which is leading to heart attack and cardiac arrest. The news saying 20-year-old dies of heart attack, a 48-year-old, a 40-year-old actor Siddharth Shukla. So the numbers are drastically increasing. So इसीलिए incidence of smoke COPD and lung damage is decreasing, क्योंकि 40 years से कोई स्मोक कर रहा है उसको MI नहीं हो रहा है, इज वेरी रेयर नाउ. Okay. So again, heart attacks are becoming common in young people, and this is the cause, as we have already discussed just now. This is a study, a very legit study, which is showing the incidence of smoking and the incidence of heart attack. Also, the mortality is more in smokers because there is complete occlusion. So atherosclerosis में क्या होगा? This is the vessel. वो धीरे धीरे occlude होगी, धीरे धीरे occlude होगी. जब वेसल धीरे धीरे occlude होगी तो इट्स अ क्रॉनिक प्रोसेस. क्रॉनिक प्रोसेस तो आगे कोलेटरल्स बने होंगे. बट इन स्मोकर्स क्या है, ये वेसल है, आज ही स्मोक किया, आज ही यहाँ पे थ्रोम्बस बना, देयर इज नो कोलेटरल्स, देयर इज नो क्रॉनिक प्रोसेस, इट इज एन एक्यूट प्रोसेस. एंड इन ST elevated MI, the mortality is 10%. किसी को भी एस टी एलिवेटेड एम आई होगा इमरजेंसी में, वी एक्सप्लेन देम कि द मोर्टेलिटी इज 10% वेदर ट्रीटेड और नॉट. ओके. बट in smokers with STEMI, the mortality is more than 15%. Okay. Again, smoking causes multiple diseases. So ये questions exam के लिए भी important है definitely. But but ये सारे diseases होने से पहले ही there is a huge chance that the patient will end up in MI. Okay. So let us discuss about the diseases that are there from smoking. One is stroke, then blindness, gum infection, aortic rupture or aortic dissection. So it is again very common among smokers. Then heart diseases in the form of STEMI, pneumonia, hardening of arteries, CLD and asthma, chronic lung disease COPD, reduced fertility and hip fracture. And the cancers that are there due to smoking, one of the most important is bladder cancer. It is very common among smokers. And cervical cancers, colon, pancreas and kidney cancer, stomach cancer, leukemias are very common among smokers, and literally the number of patients with AML, CML, ALL are increasing drastically again. CL lung and head and neck cancer. Okay. So it is again a academic video as well as awareness video. So try to cut down the number of cigarettes you are smoking and try to avoid smoking. Okay. All the best.